Hello, everyone. This is a recording on sensory processing that we're having you watch for lifespan development. There is a previous video of this slide that has been in the Moodle course, but I decided it was time to do just a little bit of an update to the flow of the material and also to some of the pictures. So if you've had a chance to watched that previously just out of your own curiosity, you'll notice just a few differences, and I will update the handout on Moodle as well. What I'm presenting on today actually comes from some information that was presented at the Primary Children's Hospital, and it was presented by occupational therapists, and it was on how physical therapists and speech therapists can apply the principles of sensory processing into their treatments. And I found that it was very useful, not just for children with autism, but as kind of a strategy for improving motivation and participation with all of my patients. And we'll talk about how some of this application can be a little bit broader than just maybe what people typically think sensory processing disorders being paired with autism spectrum disorders. So we'll get into some of those mechanics and hopefully provide you with a strategy, some techniques you can use to improve patient participation, especially if you would be working with children. So I want you to understand some basics of sensory processing disorder. We're going to get into a differentiation between seekers and avoiders when it comes to the different preferences or sensory profiles that people can have. We'll go through each of the senses and how someone with a different sensory preference might present. We'll talk about sensory integration therapy. Mostly just, we're really just going to introduce it. And then we'll give you some opportunities to think about how to brainstorm a sensory-based approach for patients. We have a couple of cases we'll go through at the end. I'm going to try and break this up into multiple videos so it's not just one giant boring chunk. And so my plan is to have this broken up into 3 different videos. So we'll get more into the introduction of sensory integration therapy and some of the background in this first video. So the question we have to answer in this first video is, what is sensory processing disorder? What's a sensory anomaly? Well, I want to highlight what it is and what it isn't. So it is a way to describe behaviors in children, and I mean, in one way we could expand it to anyone, based on the ability to process environmental inputs. Basically, how do we handle sensation and how does that affect us? What it also is a way to describe poor processing of sensory inputs at the central nervous system level, not the sensory level. And what I mean by this is, a sensory processing disorder doesn't mean that the stimuli coming into the body aren't interpreted. They are sensed, and that information goes up to the brain. It's then in the process that normally happens where we get sensory information, it's processed, and we respond. It's that processing component that's altered for people that have a sensory processing disorder. So they can feel, but what they feel is processed differently. And it is a theory that can be useful when addressing behaviors that are difficult in patients, specifically children. Now, it isn't the answer to all poor behaviors in children. Sometimes kids are just having a bad day. Sometimes they have behavioral issues that are beyond sensory. I also want to emphasize that this is not a replacement for exercise training. If someone has motor skill issues, a sensory approach is not the magic bullet that's going to do the trick. It's not going to make them better suddenly. What it is I found that this is a useful approach to improve participation in exercises and other meaningful activities that need to be addressed. I'll emphasize again that this is not related to poor sensory ability, meaning that the sensors are all intact. We don't have vision difficulties, we don't have hearing difficulties, we don't have impaired sensation because the receptors are affected or that even the pathway is affected. This is after that. It's in the central nervous system when the information has been transmitted and it's being processed. And the last thing that sensory processing isn't is clearly defined. So if you do a Google search, you're going to find a whole bunch of information, and it's all going to be kind of the same and kind of different. Um, this is not a reimbursed intervention by itself. So there is a sensory integration training. That's a CPT code, but it's not reimbursed by itself. So there's not a lot of research that I have seen yet that's very clear that says, oh, this works, and that's part of the reason why it's not very well reimbursed. So there are different types of sensory processing disorders. So the most common or the typical sensory processing disorder that people think of is a sensory modulation disorder. And this is where someone is maybe over responsive to stimuli or they're under responsive to stimuli. So again, they're getting all of the sensation. That physical process works. But then when they go through the processing of it, their brain is either very, very attuned to it or maybe doesn't recognize it or give it its full weight. There are so over responders tend to be the kinds of kids that are very sensitive. They're hypersensitive is one term that we might use to describe them, and we'll get into this more later. Under responders tend to be sensory seekers. So they get the information, it's processed, but not given like a full value. And so the child is going to look for more sensory stimulation. There are some types of sensory processing disorders called sensory discrimination disorders, and this really does sound more like a neurological issue. So there could be a postural disorder or a dyspraxia. This sounds like post-stroke, right? Someone has a stroke and all of a sudden they're dyspraxic. You ask them to do something and they can't figure out the motor program for it. That's a very severe form of sensory processing disorder, and it's pretty rare. If you're just seeing a kid that, my kid has sensory issues, if someone tells you that, it's more likely that they just have a sensory modulation disorder. And then there are described sensory-based motor disorders. I'm going to question if that is an isolated condition or if maybe it is a way to describe developmental delay. I could see it being a way that people describe developmental delay as, oh, they're just not processing the information coming to them, which is why they're not moving appropriately. I don't know that there's a clear differentiation between the two. What I want you to understand from this is that most sensory processing disorders are a sensory modulation disorder, and it boils down to the over responsivity and the under responsivity. So, sensory approaches to treatment can be useful when you're dealing with poor behaviors. And this can include things like crying or tantrums, or even something as simple as just like really bad attention. It can also be effective when working with patients that have poor arousal. So, if someone's too sleepy, they're under aroused, or maybe they're really anxious, so they're over aroused. These kinds of techniques can be used in adults and children to kind of moderate some of those sensory responses that are out of whack and improve participation. So, on these next two slides, these are screenshots of handouts that I have in Moodle. These handouts are screening tools that you as a physical therapist could have a parent most likely fill out regarding their child to get an idea of if there is a sensory issue going on. A typically developing child or a child that doesn't have a significant sensory disorder might have a few items circled on the page generally, but there may not be a clear pattern or there might not be a lot of items. Now, if a parent's really attuned, they might be sensitive to their child and they might be able to identify multiple areas, but then the question becomes are those behaviors affecting the child's ability to function in their environment? Is it affecting their ability to participate with their family and with their peers? So usually I administer this not on everyone, because we'll talk, if you think about it, everyone has some kind of a sensory preference. And so the screening tool is one that I'll use when I notice behaviors in treatments that are detrimental, or if a parent reports there are significantly detrimental behaviors that are affecting uh, behaviors at home or school or on the way to treatment, things like that. So this is the screening tool, or the screening questionnaire for children. And then I also have a screening tool for infants. And again, these are posted in Moodle in a file or a folder underneath this video. So this is the end of our first video. You have an assignment. I'm going to recommend that you wait to finish this video series before you complete the assignment, but I'm going to tell you about it now because it involves those checklists. What your assignment is, and double check the instructions in Moodle. But what I want you to do is basically find a kid, find an infant or a child. Typically, this is better to perform on a child before adolescence, or maybe pre-adolescence at the latest. But use the appropriate checklist for the child's age. So if you're doing it on an infant, use the infant checklist. If you're doing it on a child, use the child checklist. I want you to, if it's your child, a niece, a nephew, a friend, I don't really care whose kid it is. I want you to find a kid, and I want you to, with the help of their parents, complete the sensory profile on that child. And then there's a little reflection paragraph I want you to write about that, which you'll be able to do better after you finish the rest of the videos. So I'm going to end this video here. We've got 2 more videos to discuss sensory processing, but no, you do have an assignment to kind of verify that you took the time to go through this information.